All right, let's peel back the coating on something most of us see every day, a simple pill. But what we're about to uncover is the absolutely incredible hidden science that has to happen to make sure that little pill actually works.
I mean, have you ever really thought about it? You take a sip of water, you swallow, and you just assume the magic happens, right? But what's really going on down there?
Well, it turns out that little pill is about to go on an epic and, honestly, a pretty dangerous journey through your body. A journey that, frankly, it might not even survive.
And that wildly unpredictable path, that brings us to the core problem that pharmaceutical scientists have been trying to crack for decades.
You know, the mission seems so straightforward. Get the right medicine to the right spot at the right time in the right dose. Easy, right? Well, it's anything but.
That's because our body is this incredibly complex and kind of hostile environment. It's not designed to just let some foreign substance wander through wherever it wants. No, it has defenses.
And the very first, and maybe the biggest, defense a pill runs into is a massive chemical challenge. It's what we call the pH problem. Okay, so take a look at this. This is the chemical roller coaster we're talking about. A pill gets swallowed and lands in the stomach, where the pH is around 1.5. That's as acidic as battery acid. But then, just a little while later, it moves into the intestines, and the pH shoots up to a much more alkaline 7 or 8. That is some serious chemical whiplash.
So what? Why is this chemical joyride such a huge problem for the medicine you're taking?
Well, it all boils down to one critical word: solubility. See, for a drug to actually get into your bloodstream and do its job, it has to dissolve first. But for a whole lot of drugs, their ability to dissolve is completely at the mercy of the pH that's around them.
Let's look at a perfect real-world example. This is a drug called dipyridamole. Check this out. In the acid of the stomach, at a pH of 1.2, it's super soluble, 30 milligrams per milliliter. But now, look what happens when it gets to the neutral pH of the intestine. The solubility absolutely crashes by more than 1,000 times to just 0.02. It basically just stops dissolving.
And this just shows you the problem perfectly. On the right, in an acidic solution like the stomach, boom, the drug dissolves into a nice clear liquid. But look at the left. In a neutral pH, like in your intestine, it just sits there, a useless powder. And if it can't dissolve, it can't be absorbed. So what's the result of all this? Your treatment can literally become a game of chance. Sometimes you get the right dose, sometimes you get almost nothing. It's just dangerously unpredictable.
So how in the world do we fix this? How do we outsmart our own body's chemistry? Well, the answer is you have to build a much smarter pill, one that just doesn't care about pH.
Okay, so our first piece of genius engineering is a pill that's, well, it's actually a tiny, microscopic pump.
Take a look inside this thing. This is not just a bunch of powder. It's got these distinct layers, an outer membrane that lets water in, a compartment with the actual drug, and this thing at the bottom called a push compartment.
So here's how this little machine works. First, water from your body gets drawn into the pill. This makes that push compartment swell up, which builds up pressure. That pressure then acts like a tiny piston, forcing the drug out of a little laser-drilled hole at a perfectly steady rate, no matter what the pH is outside. It's brilliant! All right, now for a completely different strategy. What if, instead of just ignoring the body's environment, the pill could create its own perfect environment wherever it went?
This little bead is built in layers, like a tiny onion. There's a core in the middle, then a layer of an organic acid, then the drug itself, and finally a special coating. This isn't just a pill, it's like its own self-contained ecosystem.
So that acid layer creates this perfect little acidic bubble, a microenvironment, right around the drug. This makes sure the drug dissolves perfectly, even if the bead is floating around in the alkaline parts of the intestine. It basically brings its own weather system with it.
Now, these technologies are just amazing feats of engineering, for sure. But what does it all really mean for us, for patients? Why is this such a big deal?
This slide just sums it all up, doesn't it? We're moving away from that old, unpredictable lottery system of pH-dependent drugs where dose failure was a constant risk, and we're moving into this new era of pH-independent delivery. And that means consistent drug release and reliable, predictable performance every single time. And for you and me, what that really means is a treatment that just works the way it's supposed to. It means steadier, more reliable results, and often it means you can take fewer pills. That makes it easier to stick with your medication, and ultimately, it just leads to better health.
And hey,
Don't just take my word for it. As this recent research paper says, creating these pH-independent systems is one of the holy grails of pharmaceutical science. Why? Because consistency is absolutely the key to effective treatment.
It really makes you think, doesn't it? We are literally engineering medicine on a microscopic level to overcome our own body's natural defenses. So, if we can solve a problem as fundamental as this one, what other unsolvable health challenges are next on the horizon? What's next for medical innovation?